Welcome to the TikTok Podcast, a place for real conversations about Lyme disease and tick-borne illness. Hosted by Christina Murphy, Lyme advocate, educator, and vice president of the LEAF program. This podcast brings together patients, doctors, researchers, and families, working to change how Lyme is understood, treated, and prevented. These are the stories, the science, and the voices driving awareness forward.
Well, hello.
Hello, Christina.
How are you, Myra?
I'm doing okay today.
Wonderful. Well, I wanted to say welcome. We're doing an awareness podcast on ticks and Lyme disease. And Myra is a fabulous person who has been working as a biostatistician. And it took me a long time to learn how to say that word. And I probably said it wrong, didn't I?
No, you did well.
Yay! Fantastic. All right. So I wanted to, give you a little bit of props for your bio. I mean, you've worked with the folks over at MyLymeData, right? You organized
LymeDisease.org with their MyLymeData patient registry.
Wonderful, wonderful. But Myra has her own business as a biostatistician researcher, and she has been doing work also with the Center for Lyme Action.
I volunteer with them.
Yes, you're a volunteer with Center for Lyme Action. So in this journey of Lyme disease, where Lyme disease has been in the United States for about 50 years, can you tell me your experience?
So as you mentioned, I'm a researcher and a volunteer in the Lyme community, but I'm also a Lyme patient. I contracted Lyme disease in approximately 1982, before much was known about it, at the Assateague Island National Seashore. I went camping and came home with ticks behind my knees. And my friend, I knew nothing about ticks, and someone called me and said, "You should check for ticks." I was like, "That's great. What are they?" Then I called back, and now that I found them, what do I do? So my journey started there. Okay. I didn't know what to do. They helped me remove the ticks, and I went off to Spain the next week to an international peace conference. While I was there, I experienced gastrointestinal symptoms, joint pain, muscle pain, and total exhaustion. And I was traveling around Europe on trains, like you do when you're young, etc. And it got worse while I was there, to the point where somebody that I knew in Spain had me stay with. So those were my initial symptoms.
Okay.
And I came back to the United States, and my symptoms escalated. I kept having fatigue and muscle pain and various other kinds of problems. And every time I went to a doctor, they dismissed me as being, I'll use this word, I don't like this word, but fat and crazy.
Oh dear.
So basically I was overweight, and they accused me of that all of my pain and all of my exhaustion and all of those things were because I was overweight, and it was all in my head. And I know this is not an unusual quote unquote diagnosis. There are many people who've experienced this. And I went to, it took me more than 20 years to get a diagnosis.
That's quite some time. So with that going on, I mean, without the proper diagnosis, I mean, how did this experience, how did you deal with this personally and professionally? I mean.
Well, at the time I was working in the computer industry.
Okay.
So fortunately, at certain points, I was able to work from home before it was in vogue. So that helped a little bit, and my hours were flexible. But I was always tired, and I quit jobs more often than I would have, I think, had I known what was wrong or had I been treated. And I think my career trajectory was not what it should have been given my talent and my knowledge. In addition, throughout that time, I got married and I had a child and all of that. And the other issues that I experienced were written off as, oh, you're just depressed. Oh, you're anxious. Oh, you have a quick temper. And I wrote it off to being from New York. No disrespect to people from New York. I'm from New York. But it really wasn't that. I overreacted to things in a way that didn't make sense. And only recently there's been research about the link between Lyme and how it affects the physical part of your brain and affects your behavior. Okay. So I wish I had known that. I wish I had been treated, because it affected my personal relationships, my work trajectory, and all of that.
So finally, you were diagnosed in 2003, correct?
Correct. I was living in Maine at the time, and I had a really bad reaction to a flu vaccination. And let me preface my comments by saying I think vaccinations are desperately important and safe for the majority of people and important for public health.
Okay.
So just to clarify that. But after the flu vaccination, I had a dropped foot. I was partially paralyzed on my left side. And then I had double vision, and I had Bell's palsy and various other neurological symptoms. And at that point, after having a bunch of other misdiagnoses along the way, at that point I was diagnosed with MS. And as somebody who has a science background, I was like, something isn't right here. My symptoms escalated over time, and it just didn't make sense to me. So I dug a little bit deeper, and I found Dr. Sam Donta in Boston, who's now retired, who diagnosed me and put me on medication and basically gave me my life back. I had an elementary age child and couldn't do all the things I wanted to do. And especially when I had double vision, I couldn't drive, etc. And it took a long time, even after starting that treatment, to really get to the point where I understood my body and understood what I needed to do to keep myself healthy. And it's an ongoing battle.
Yeah, I was just about to ask that, if, in terms of understanding your own health, after this.
It's diagnosis. An ongoing battle. I still have residual effects. I still have to, be very careful. And as an example, yesterday I had a plumber in my house. I was tucked away in my office. He was out there with my husband, and anybody that comes into my house, I don't let them, it has to be fragrance free, because as a result of all of this, I have multiple chemical sensitivities, among other things. And I walked out of my office when he was done, and and he didn't do it on purpose, but I had to run and take Benadryl because I couldn't breathe from that. So I'm highly sensitive to odors and fragrances, among other things. So I'm very careful. I still wear them. A lot of people are not masking anymore, but I have to be very careful not to get flu or COVID or anything. So when I go into places with multiple people, I'm always masking. So it's ongoing, but I can say I'm able to walk now. Hopefully the really bad neurological symptoms are behind me, but I do have residual effects.
Okay. So let's go into research and science now. Your work as a biostatistician, consultant with, LymeDisease.org, and for other people who aren't families, what do you actually do?
Okay. Well, first of all, I got my degree in public health and biostatistics after I was diagnosed, because even though I had a lot of background, that propelled me to get that degree because I wanted to do more to help other people as well as myself. A biostatistician takes data and turns it into information that can be used. Okay. So my work with Lyme disease, LymeDisease.org is the biggest communications network in Lyme, and they've enrolled over 20,000 patients in their patient registry, MyLymeData. So I help them analyze that data and look for what are the worst symptoms that people have, and the kinds of things that will help clinicians and patients understand how to treat and understand and treat Lyme disease. so I work with de-identified data, but we get information like the age range of people. Is it different in men and women? And yes, it is. We published a paper about that. I work on peer-reviewed publications, and also things like early diagnosis and treatment is absolutely very important. What kinds of treatments work for people? Quality of life changes associated with Lyme disease. Did you have to quit working? Do you have to use a cane? Those kinds of things. So we have all kinds of information on 20,000 people who've come to the website and filled out a questionnaire.
So
and
you co-authored all of this.
Well, I'm a co-author. I don't do it alone. The CEO of the organization, Lorraine Johnson, does an amazing amount of work, and it's been around for a while. We just published actually a chart book.
Nice.
With a summary of a lot of this data. This is 10 years worth of data.
Okay.
In addition, their website has a Lyme basics section and a symptom checker, which is great for somebody to get started if they need information. Because as we know, on the internet, you can find good and bad information about anything. And this information is solid science with clinicians that back it up, etc.
Oh, wonderful. We'll have to get that information for later.
Sponsored by Dublin Roasters is the Frederick Coffee House, fueled by love and positivity. Visit Dublin Roasters at 1780 North Market Street or at DublinRoastersCoffee.com, where you can order online and have coffee shipped right to your door. You can sign up for a monthly membership as well, open for curbside and deliveries 7 days a week. Frederick's changing fast. New restaurants, big projects, community debates. Don't hear about it a week later on Facebook. Wake up with Danny Gurry on Good Morning Frederick, the only show that's first with what matters in your backyard. The show airs weekdays at 9 a.m.
Why do you think we still struggle with accurate diagnosis and consistent treatment?
Okay, well, that's as you know, that's a very long and complicated question, but I'm going to try to boil it down. First of all, for many years, the testing that was done, there were tons of false negatives in terms of trying to diagnose Lyme disease. And there are a bunch of co-infections as well, but we're talking about Lyme right now, but there's Babesia, Bartonella, and alpha-gal, which has been in the news. So there are a host of other diagnoses. Sometimes the ticks carry a lot of nasty pathogens.
Correct.
But so there is that problem, the problem of the testing not being sensitive enough, that there were a lot of false negatives. There's also a political piece to it, because the Infectious Diseases Society of America, and I'm not going to go down this too far, but they set what was the gold standard for diagnosis, and that included this test that was not sensitive enough to detect Lyme disease. So people listened. So that's changing, and there's new testing now. IGeneX and AccuDart are two there's better testing. There's also some innovation going on thanks to the Cohen Foundation and public and private partnerships. So new testing is coming down the line. But ideally, you need clinicians that know about Lyme disease. So clinician education is desperately important. ILADS, the International Lyme and Associated Diseases Organization, does do some training. And both on their website and LymeDisease.org's website, you can find Lyme literate physicians.
Okay, so
the other thing is public awareness, and that's part of what we're doing today.
Right.
Like your program, the LEAF program, is great because you go into schools and you have a game and you teach kids. Right. And a lot of people have said to me, oh, you can't tell kids about this, they'll be scared. I said, no, that's not the point. The point is to be aware and to teach kids about it, so if they get bitten by a tick or if they see a tick, they can bring it home, because you can get the ticks tested, as we both know, and that can tell you what the tick is carrying. And also, you don't want kids to be afraid to tell their parents that they found a tick or were bitten by a tick.
Right.
So educating them about that is important. And the other thing is prevention.
Right.
There are all kinds of things you can do. You've seen people, I'm sure, hiking where their socks are pulled up over their shoes. Yes, it doesn't look that attractive, but that's a good thing. It keeps the ticks potentially from getting in. You can use sprays. There's clothes that are treated, and also doing tick checks.
Right.
When you come back from the woods, I go camping. I have an RV. I go camping with my dog, and I have something that I use that I rub over my skin. It's a new product, like a mitt that helps grab the ticks if there's some on my body. Hopefully there's not, because I use sprays and all kinds of things.
Oh,
I also go over my dog every night. Pardon?
What is it called?
Oh, what I use, it's tick mitt.
Thank you. Thank you. We got to let everybody know what all of these things are so that they'll know and go looking for it.
And there are things that are not toxic that you can spray. And I don't know the names of what I use, but I use things that are unscented, of course, because of what I said before. And you can get clothes that have been treated and it doesn't wash out right away, or you can treat your clothing with a different kind of spray. So there are lots of things you can do to at least reduce the possibility of getting bitten by a tick.
What do you do for Center for Lyme Action?
I'm the Maryland co-lead for the Center for Lyme Action. The Center for Lyme Action works on Capitol Hill to advocate for funding for Lyme disease research and alpha-gal research, tick-borne diseases and alpha-gal. And I'm the co-lead for Maryland. And what we do there, among other things, there are people there that do things all year long, and I help with that when I can. But there's a virtual advocacy day. And this year it's February 18th. We meet with our senators and representatives in Congress, and we have people from all over the country associated with the different areas, but I happen to be in Maryland. I'm fortunate. My congressman is Jamie Raskin, he is very involved in this. And actually 2 years ago, often when we have these meetings over Zoom, so you meet with the senators and you meet with your congressional representatives, and the constituents meet with their individual representatives.
Right. So,
because certainly they want to hear from their constituents. And actually 2 years ago, Jamie Raskin himself was actually on the call with us, and we tell our stories. Everybody who's on the call tells the story about their experience with Lyme disease. And we go over the federal appropriations bills that are coming up in the Senate and in the House, and inform them about them and help them understand what it goes for and why it's so crucial. Patients, family of patients, whoever wants to get involved, and we let their voice be heard as much as we can. I mean, you can't have everybody that has Lyme disease talk, because the meetings would go on forever, but we take different roles in each of these meetings to inform. A lot of times it's the staffers in those offices that we talk to, but they're the ones associated with health reform and health policy. So it helps with health policy and helps the congressional representatives and the people in the House and the Senate understand what it is they'd be voting on. And it puts a face to the legislation when they hear from their constituents.
What roles do people play?
Well, some of the people describe the legislation and the asks. Some people tell their story.
Okay.
Some people are just there as another face and listen.
Okay.
And we answer questions. And we try to develop over time relationships with the staffers in these offices, so we have an ongoing dialogue so they understand new things that are coming down the pike and how they can help us.
Okay. So what do you see as the biggest gaps in federal funding for Lyme and tick-borne diseases right now?
Well, the first thing is things are getting better. The Center for Lyme Action has done a very good job of increasing funding over time, but we need more. Compared to other diseases and the number of people affected, it's minuscule. We need a lot more. The Kay Hagan Tick Act is up for reauthorization. So that's something that's very important. The Cohen Foundation works on the LymeX innovation, where we're trying to get better testing, and it's a public-private partnership, and we're trying to get the federal government to at least the Cohens have devoted a lot of their financial resources to this. But it's a public-private partnership, so the federal government needs to cover about $5 million, which in the scheme of things is very small, to cover the administration of those programs. And some of the innovative testing that has come specifically from that program. The other thing is physician education.
Yes.
Financing physician education and public awareness. And one of the things that's very important with public awareness campaigns, and we've found this with other kinds of things like smoking campaigns, you have to focus on what it takes to get healthy as opposed to the horror stories. If you focus on the horror stories, you're not going to get people aware.
In learning the prevention, I understand we have to get the doctors on board and fill them in on all the newest information. Did I gather that correctly?
Yes.
Okay.
And they need to understand what to look for, because the best way to diagnose Lyme disease is to listen to the patient.
Okay. All right. How can everyday people participate in the advocacy of say getting the doctors on board, or just getting like local people in the community on board?
Well, the first thing, if you look at the Center for Lyme Action, they provide information so that you could write to your representatives in the House and in the Senate, and they give you the whole template. So you can just send an email or call, because that will help with federal funding.
All right.
There are also local groups, your LEAF program, other kinds of programs that go into the schools. The other thing is to be informed and to talk to people. As I mentioned to you last time we spoke, I go to a lot of music festivals. Right. And Center for Lyme Action has a big green button, I wish I had it here, that has a tick on it, and I wear it. And I also bring materials. So I try to inform people, but if I'm walking around with a big tick button, people say to me, "So you like ticks?" No, I don't really like ticks, quite the opposite. But then we start to talk, and they start to tell me their story. Right. And what I do is I say, I'm not a doctor, but I point them to websites with accurate information and help inform them about how they can protect themselves and how they can find the resources they need if, in fact, they do have Lyme disease or are bitten by a tick. The other thing is it's important that if you suspect that you have Lyme disease, to get accurate testing, like from IGeneX. Mm-hmm. If you have a doctor that doubts you, if you have that result, you can take it to your doctor, because they can't deny positive test results. So it would be harder for them. And then you're actually giving them hardcore evidence that they need.
Right. You said something briefly earlier, something about testing ticks.
There are lots of places where you can send the tick in. And I know you're aware of more of them even than I am, but you can send the tick in and they can test it and see what pathogens it's carrying. Because ticks carry more than Lyme disease. As I mentioned, just a couple things: Babesia, Bartonella, Ehrlichiosis, alpha-gal. And alpha-gal has been in the news most recently. That's where people are allergic to meat, but it's not just meat. It's a protein that's in capsules and all kinds of other things, and it can be deadly. So bringing all of that to light and helping people understand what they need to do to protect themselves and get treatment is crucial.
Absolutely. Absolutely.
And the other thing is the early diagnosis and treating it early are also crucial. That's one of the things we found. That's sort of common sense, but also what we found in our research. Because if it's treated at the acute stage, you're less likely to develop what's called persistent or chronic Lyme disease, like what I have, and with neurological symptoms,
Right.
etc.
Now, if I had a child, what would I tell my child right now about a tick? I mean, how would you answer that?
My child is an adult now, so,
Oh.
but I would do it in a way that is positive without scaring them, but informing them. So the first thing is, some kids love bugs, and some don't. But the important thing to say is, you know what, you can get sick if you get bitten by a tick, but come tell me if that happens. But also show them things like pulling their socks up and spraying their clothing and that kind of thing. And letting them know that, it can happen. We're going to try to avoid it. But if it happens, come and talk to me. I think that's the most important thing.
Right.
Because you don't want to scare a child so they're afraid to tell their mother and think they did, or father, because they thought they did something wrong because they got bitten by a tick. And if they can capture it without squishing it, that's great. If it's just crawling around, and bring it to their mom or dad so that it can be sent in for testing. But I really think taking the positive side and trying to have your child be a partner with your child in the prevention and understanding what you need to do is really important, because when a child is scared, they might, everybody's different, but some kids won't talk to their parent about it. They'll
What gives you hope now in getting this awareness out?
Well, first of all, there's more in the media.
Okay.
Some good, some bad, but awareness is really important. And I think the information about alpha-gal in the media is important. The information about Lyme disease is important. There's been some movement with the HHS about Lyme disease, and they're doing some more to raise awareness. We'll see where that goes. And programs like yours, the LEAF program, working with kids, and also what Center for Lyme Action is doing, increasing funding and getting the word out and getting more people involved. And for instance, and you don't have to be a scientist or even a patient to spread awareness, but if you know somebody in your family who's had Lyme disease, or everybody I talk to, either their cousin or their spouse or they know somebody with Lyme disease, spread the information around, send them to say, but wait a minute, you can get help. These are the places to look for information. And I think helping people find accurate information is really important. And also the fact that newer testing is available and more doctors are getting trained, although we have to increase that, is really helping.
Okay. So everybody out there, if you want to spread awareness, talk about it, have everybody tell you their story, right? That's what the bottom line is?
That's the bottom line. And the thing is, every place I go, I end up mentioning Lyme disease, and it's amazing how often it comes up, no matter where I am. And I always carry something with me that has Center for Lyme Action and LymeDisease.org. Those are good places to find information. And I help point people to places where they can get accurate information and where their friend or relative can find lists of Lyme literate clinicians.
Okay. All right. So I'm going to say this is the last question I'm going to ask you is, what is the one thing, the one takeaway that you want everybody to know about being aware about Lyme disease?
Well, the most important thing I think is prevention. But if in fact you are bitten by a tick, get yourself to a doctor, make sure they put you on a a full course of antibiotics, which it depends where you read it, but is a month or more, and get ticks tested.
Okay.
But don't be afraid of going to the doctor and advocating for yourself or your family member. It's really important. And if the person you're going to isn't listening, go somewhere else and find somebody that's going to listen and understand what's going on and get treated early on. And also, if you have persistent Lyme disease like I do, or if you've had a long course of Lyme, don't give up. There are things you can do to feel better and be your best. You may not be back to perfect, but you can feel better.
Awesome. This is wonderful, Myra. Thank you.
Thank you for the opportunity to talk about this, because as you know, it's near and dear to my heart.
Absolutely. Absolutely. And we'll have to catch up, okay?
Okay. Thank you.
All right. It's been my pleasure to talk to Myra. And remember this date, February 18th?
Yes.
Center for Lyme Action. If you can find them online and you've got Lyme, tell your story, get out there and make people aware, okay? All right. Thank you so much, Myra. It's been a great time talking with you.
Thank you.
My pleasure.
You've been listening to the Tick Talk podcast, hosted by Christina Murphy. If this episode informed, inspired, or helped you better understand Lyme disease, take a moment to subscribe, share, and leave a review. Your support helps these conversations reach the families and communities who need them most. As always, you can watch all past episodes on the Everything Frederick Live YouTube channel.